Rankings, Spectrum Health has a top 10 joint replacement program in the country.
And for those dealing with arthritis in the knee or the hip, replacement is often the best but last option. Fox 17's Eric Francis explains in tonight's Medical Moment.
Dr. Chris Sherry of Spectrum Health used to be a runner, but knee pain in his early 30s forced him to alter his exercise routine.
I try to lean patients away from the running aspect, to direct them more towards biking, swimming, things that are elliptical machines.
He says there are many different causes of arthritis that cause the pain, stiffness, and swelling of the knees and hips.
There's a genetic element. Sometimes you're kind of predisposed to having arthritic type symptoms in your body. Some of it's environmental. It can be traumatic injuries that you've had before in your life. Sometimes people that more demanding activities, jobs, can have increased rates of arthritis.
Anti-inflammatory medications and physical therapy can provide temporary relief from the arthritis in those joints.
There's also lubricating medications that are in the class of medications called viscosupplementation that reduce inflammation.
But Dr. Sherry wants his patients to know of another, simpler way.
Losing weight can cause significant decreased load and demand on your joints and ultimately lead to lower rates of osteoarthritis in the body.
But once cartilage starts to erode, the temporary relief no longer works.
Yeah, unfortunately, none of the conservative treatments that we talked about, they're not putting cartilage back in the knee or the hip. They're not an ultimate fix that we're talking about.
And most will require knee or hip replacement surgery.
Basically, we don't have any arthritis in this knee anymore. We just have metal and plastic.
Dr. Sherry says both surgeries have a better than 90% success rate.
Really the biggest part of these surgeries is the rehabilitation portions afterwards. The idea is to get you back to, like I said, a painless knee with good range of motion that ultimately you can do the activities that you once did and that you want to do.
And after the surgery and rehab are over, Dr. Sherry says he usually hears the same reaction.
The most common thing that I get is, I wish I would have done this sooner.
Derek Francis, Fox 17 News.
Now, Spectrum is hosting an upcoming seminar called Solutions for Hip and Knee Pain. It's free, but you do need to pre-register. The number to sign up right there on your screen. Well, a wild scene this weekend at a California restaurant.
A fish tank suddenly exploded and it was